Hello everyone, welcome to Medios at Last channel. Today we are going to be talking about popliteal fossa. So, what is popliteal fossa? First of all, let us talk about its literal meaning. So, popliteal means back of the knee and fossa means depression. So, the depression present on the back of the knee is the popliteal fossa. So, popliteal fossa, it is rhomboid shaped or it is diamond shaped, as you can see in this diagram. This is the popliteal fossa. In this video, we are going to cover its boundaries, its contents, and its clinical anatomy. So, about the boundaries, let us see in this diagram. This is the medial side and this is the lateral side. So, in this part, the superomedial part is bounded by semitendinosus and semimembranosus, and superolateral part is bounded by biceps femoris, and inferomedial part is bounded by medial head of gastrocnemius, and inferolateral part is bounded by lateral head of gastrocnemius, which is simple. Now let us talk about the floor. The floor is formed by the following four structures, which are the popliteal surface of the femur, the capsule of the knee joint, the oblique popliteal ligament, and the fascia covering the popliteus muscle. So all these four form the floor of the popliteal fossa. So now let's talk about the roof. The roof is formed by the deep fascia. The deep fascia is covered by the superficial fascia, and the superficial fascia in turn is covered by the skin. So there are contents which pierce through the roof and then pierce through the superficial fascia. And there is this one content which does not pierce the roof, which is the posterior division of medial cutaneous nerve of the thigh. And the other three structures pierces through the roof and also the superficial fascia. So the other three are posterior cutaneous nerve of the thigh, the terminal part, and the short saphenous vein, and the sural communicating nerve. So these are the four contents that pierce through the superficial fascia. Now let us talk about the contents of the popliteal fossa. So this is the popliteal artery, the popliteal vein, and the tibial nerve, the common peroneal nerve, the popliteal lymph nodes, the popliteal pad of fat, and also we have the terminal part of posterior cutaneous nerve of the thigh and descending genicular branch of obturator nerve and terminal part of short saphenous vein. So all these are the contents of the popliteal fossa. Now let us talk about how they are arranged in the popliteal fossa, the three avians, which is artery, vein, and nerve. So how they are arranged? The artery is basically, it traverses from medial side to lateral side, and the vein, it traverses over the artery from lateral to medial, over the artery from lateral to medial. And the nerve will pass over the vein from lateral to medial. So from lateral to medial, these two. Over the artery, the vein, and over the vein, the nerve. And if you remember this part, it's very simple. Or if you remember this diagram also, you can simply derive this, which is nothing but in the upper part from medial to lateral, it is avian. In the medial part, middle part, it is nerve, then vein, then artery. And the same thing, the nerve, vein, and artery in the lower part. Now let us talk about the popliteal artery. So, at the adductor hiatus, the femoral artery continues as the popliteal artery and it traverses vertically downwards from medial side to lateral side till it reaches the popliteus muscle. There it divides into anterior tibial artery and posterior tibial artery. Now let us talk about the relations of the popliteal artery. It is quite simple. So if you take this as the popliteal artery, anteriorly it is related to the floor of the popliteal fossa, and posteriorly it is related to the popliteal vein and tibial nerve, the facial roof, the superficial fascia, and skin. So we have 5 things related on the posterior side. They are the popliteal vein, the tibial nerve, the facial roof, and superficial fascia and the skin. So these are the relations of the popliteal artery. Now let us discuss the branches of the popliteal artery. So there are 3 groups. They are cutaneous, muscular, and genicular. So the cutaneous branch gives to the skin, it provides or it pierces the skin. The muscular branch is divided into 2 parts, the upper branch and the lower branch. The upper branch are 2 or 3 in number and they supply the adductor magnus and the hamstring muscles. The hamstring muscles are the biceps femoris, semitendinosus, and semimembranosus. The lower branch supplies the triceps surae, which is the gastrocnemius 2 heads, the 2 heads of the gastrocnemius and the soleus. These 3 form the triceps surae. Okay. And then we have the plantaris. It also supplies the plantaris. Then we have the genicular branch. So under this genicular branch, for easier understanding, I just made this like this. It is not division, it's just that for easier remembrance. So there is superior and there is middle and there is inferior. So the superior part has 2 parts, which is medial and lateral. The inferior part has 2 parts, medial and lateral. The middle doesn't have anything as such. So these 2, the anastomose above the femoral condyles. The point here that you have to notice is that they anastomose above the femoral condyles, but they wind around the femoral condyles. No, they also wind around the femoral condyles. Now, if you see in this diagram, you can appreciate it. These are the femoral condyles, and these are the superior arteries. You can see that they are winding around the femur, and they are around the femur above the femoral condyles, and they anastomose here. Then we have the middle genicular artery. It basically pierces the oblique popliteal ligament and it supplies the cruciate ligament and synovial membrane of the knee joint. So 2 things it supplies. Then the inferior part, it winds around the tibial condyles. So it does not wind below or above. It winds around the tibial condyles. So the difference is here it is around and here it is above. You can see in the diagram and you can appreciate it. It is above the condyles and it is around the condyles. Yeah, and here also anastomosis takes place. So we have these genicular anastomosis, right? Now let us talk about the popliteal vein. So this popliteal vein, all the veins, they join to form the popliteal vein, and at the lower border of popliteus, it traverses upwards and continues as the femoral vein, and at the lower border of popliteus. It is alongside the anterior and the posterior tibial arteries. So it traverses across this artery, the popliteal artery, and continues as the femoral vein. And there are branches of popliteal vein, which are small saphenous vein and vein corresponding to branch of popliteal artery. So yes, with that we are done with the popliteal vein. Now let us go to the tibial nerve. So there are basically 4 branches: muscular, genicular, cutaneous branch, and vascular branch. So under each we have some things to note down. So the muscular branch, it supplies or it pierces the plantaris, the gastrocnemius, the 2 heads of gastrocnemius, and soleus and popliteus, right? And the nerve to popliteus also supplies the following. They are the tibialis posterior muscle, the superior tibiofibular joint, tibia, and interosseous membrane, and inferior tibiofibular joint. Then we have the genicular. The genicular branch is divided into superior, middle, and inferior. The superior part has only medial but no lateral, because we are going to see this lateral in the common peroneal nerve. So if you remember this, you will be seeing it in the common peroneal nerve, which we are going to be discussing in the next minute. So, and the inferior part is also given to the medial part. Now, then we have the cutaneous branch, which is also known as the sural nerve. Sural nerve. So, the sural nerve is basically, it starts or it originates at the middle of the popliteal fossa, and it traverses downwards, vertically downwards, beneath the roof, so underneath the roof, and at the inferior angle of the popliteal fossa it comes out. So that is about the cutaneous branch. And then we have the vascular branch. It supplies the vasomotor fibers which supply the popliteal vessels. So with that we are done with the tibial nerve. Now then we have the common peroneal nerve, which are, so it has 2 branches, the cutaneous branch and the genicular branch. The cutaneous branch is having sural communicating nerve, and it is divided into, again, lateral cutaneous nerve of calf. So it supplies these 2 things. It is dividing. Now then we have the genicular branch. The genicular branch is again having 3 divisions, which are superior, middle, and inferior. Like I said above that, here we are having the lateral side. Now then we have the clinical anatomy. The clinical anatomy is that the popliteal pulse and the popliteal aneurysm, the swelling of the popliteal artery, and we have the Baker cyst, which is a cystic swelling in the popliteal fossa due to inflammation of the synovial bursa. Thank you everyone. Hope you enjoyed the video.